Hi everyone, this is week 5, and this week we're going to talk about last week's lesson, which was micronutrients, and we had some good questions asked. And a lot of the questions dealt with vitamin and mineral supplements, and there's plenty on the market, plenty to choose from, so it can create some confusion. So in today's question, we're going to hopefully clear up some of the confusion you might have about vitamin and mineral supplements. The first question, and this was asked by a couple of people, what do you think about taking vitamin and mineral supplements, and would you recommend taking them? I have no problem with people taking vitamin and mineral supplements, but there's a few guidelines to be aware of. We are asking you to eat a balanced diet with a variety of foods that will provide you with over 40 different nutrients that your body needs. And that can be hard to do on a day-to-day basis. And most people don't eat every day the way that we recommend. So there's always going to be maybe some slight imbalances in the nutrients you take in. And taking a vitamin and mineral supplement can help cover you on those days. There may be some days you just have a poor appetite. You may have changing nutritional needs, possibly with pregnancy, or you're developing osteoporosis, and those may result in needing some additional vitamins and minerals. So yes, they can fill nutritional gaps. But a couple of things to look at. Look for one that provides you most of the nutrients at 100% recommended level, the RDA, the recommended dietary allowance. If you have one that provides you more than 100%, you want to try to cap it off at 150%. So anywhere from 100 to 150% is a safe intake. There are some vitamin and mineral supplements, and it's mainly on the B vitamins, that they may provide you up to 1,000 times the RDA. I've even seen some that gave you 2,000 times the RDA. That's not necessary. Because they're water soluble, the excess amounts that your body can't utilize will be urinated out. So you're paying for vitamins that you're not even able to utilize. And while they're not stored permanently because they're water soluble, there is some question over long term, are we doing any damage to our body from temporary storage? So look for 100 to 150%. And for some groups, I mentioned changing nutritional needs. If you are pregnant or planning to become pregnant in the near future, taking folic acid supplements can be very beneficial. Your body actually absorbs folic acid from supplements more efficiently than it does the natural food sources. And folic acid can help prevent neural tube defects. And then you may also want to consider taking calcium and vitamin D if you're at risk for osteoporosis. And we're going to talk a little bit more about those on another question. The next question says, when comparing women's multivitamin with a mature woman's vitamin, the mature woman's did not contain the same amount of iron. And that's because a general woman's vitamin is based on someone that has not gone through menopause yet. So they are still losing iron on a regular basis through the menstrual cycles. The mature women's vitamin assumes you have gone through menopause, you're not having menstrual cycles, and therefore you are not losing iron, and it's not needed to provide as much iron. You do have risk as an older adult for anemia as you get older, and so the concern about not having the iron can be a valid concern. Some chronic conditions such as cancer, arthritic conditions, hepatitis, and ulcers are examples of conditions that can lead to anemia. And you're also at risk for iron deficiency anemia due to inadequate intake. Sometimes with older adults, meats might start to taste metallic or bitter, and they don't eat as much. Or if they're having difficulty chewing meats because of or dentures that no longer fit correctly, someone might reduce their intake of meats, and that can actually reduce your intake of dietary iron. And you can also just have inadequate absorption as you get older, and we're going to talk about that, how to increase absorption of the iron in a later question, which actually is the next question. How can I increase my iron intake and absorption? And someone mentioned when they doubled their iron supplements, they developed constipation. And taking iron can cause constipation for many people. Some people actually have diarrhea, but constipation is probably more common. There's two types of iron, and we talked about this actually a little bit last week in some of the questions in what might interfere with iron absorption. But there's heme iron and non-heme iron. Heme is in H-E-M-E. The heme iron is what is found in your animal products, such as beef and poultry and fish, and it is more highly absorbable. The non-heme iron is what is found in your vegetables and your grains, for example, and our bodies are not as efficient at absorbing that iron. So you'll absorb the heme iron 2 to 3 times more efficiently than the non-heme. So one of the easiest and most efficient ways to increase your iron intake is to look at your current meat, poultry, and fish intake. We recommend approximately 5 to 6 ounces of cooked weight a day of the different meat products. And so if you don't eat much meat, you could increase your intake there. When you eat heme iron, like from a meat, along with non-heme iron from beans, for example, you increase your absorption of the non-heme iron from the beans, or the rice, or the spinach. So whenever you're using non-heme sources, making sure that there is a meat protein, animal protein source with it enhances your absorption. Another way to enhance absorption we talked about last week, and that's to include vitamin C at the same time that you are consuming non-heme iron in particular, and you can boost the absorption from anywhere from 40 to 60%. Fortified cereals are another way to get more iron. Most cereals are fortified, but double check, read the labels, do some comparisons between them. And then keep in mind that there are some foods and drinks that if you're consuming them in large amounts might be interfering with your iron absorption. Tea and coffee are examples. Someone mentioned in response to this question that they were told by Red Cross volunteers when they donated blood to not drink tea and coffee with their meals that day, and that's a good recommendation. Whole grains, if you consume a very large amount of them, but as we talked about last week, if you have a well-balanced diet, your whole grains are probably not impacting your iron absorption. And then finally, watch garage sales and Facebook posts where people list things for sale and pick up the iron skillets. You can, iron skillets, you will actually get some iron from the skillet itself as you're cooking, and that's another way to increase your intake. Someone was asked about vitamins and minerals not dissolving in their stomach and what could they do. You want to make sure that you are buying a vitamin and or mineral supplement that dissolves in enough time to be absorbed into your system. And the way you can tell that is to look for the USP designation. It stands for the U.S. Pharmacopoeia. And this is the agency that makes sure the products meet the standards. Standards in terms of the product is pure, it contains the listed ingredients, and it dissolves within an adequate time frame to be absorbed into your system. So look for the USP designation, and then you should be using products that will dissolve without any problems. Someone asked about their doctor wanting them on large doses of vitamin D, but it upset their stomach. So what are some ways to get extra vitamin D? And this person mentioned 2 ways they knew of getting vitamin D: to drink more milk and to be outside on sunny days. Vitamin D is getting a lot of attention now. We're finding out that up to 75% of people are vitamin D deficient when their doctors are running the lab work. And the reason why that we are showing deficient for the most part is vitamin D is not real abundant in our food source, and the sun is not a reliable source of vitamin D for many people. The reason why vitamin D has hit the headlines is studies have shown recently, we knew it was important in bone health, But we're also finding, according to the results from studies, that vitamin D can reduce our risk of cancer, heart disease, stroke, and more recently, we have seen studies that show vitamin D may lower our risk for diabetes and might even help improve blood glucose control if you do have diabetes. And it's also been linked to lower risk of autoimmune diseases. So it certainly deserves the attention we're giving it right now. We talked about it being abundant in dairy products, but not a lot of other products to begin with. But I want to mention the sun exposure. We are concerned about skin cancer for good reason. The rate of skin cancer seems to be growing, and skin cancer does result in numerous deaths on a regular basis. So we're telling everybody to use sunscreen, and we're pushing, SPFs of 40, 50. So we're not letting the sun rays get in, and that's really okay because there are other things we can talk about for vitamin D. In terms of the sun exposure is seasonal. Depending on how close the sun is to the earth, it varies by the time of day. If you live in a city with a lot of smog, if you live in an area that has frequent cloud cover, if you live in a city where tall buildings block the sun rays, all of these reduce your exposure to the sun. How old you are, what your skin color is, how much skin is exposed, all these things influence how much of the sun's rays you get. And older adults, as we age, we need more vitamin D because we're getting less sun exposure, and the aging body is not as efficient at producing vitamin D, even when we do have sun exposure. So I think this was good to ask about. How can I get vitamin D? There are vitamin D supplements, but whenever you can, we want to encourage you getting them through the natural foods, and particularly this person who said the vitamin D supplement upset her system. So before I give you some vitamin D content levels of some foods, I want to make you aware the Institute of Medicine, it's abbreviated IOM, states that you need 600 international units, but the current labeling standards that are put out by the FDA state 400 international units. So if you are looking at something that says it provides 200 international units and it will tell you it's providing 50%, keep in mind that's based on the FDA. According to the IOM, you need 600. So I would look for additional sources and not go just for the 400. So some sources of vitamin D. A tablespoon of cod liver oil has 1,360 international units. Back in the old days, many of you may have heard your grandparents say that they were forced to take cod liver oil before bed. And that's because it was a high source of nutrients that, due to poverty and the depression, were lacking in people's diets. This next food is one of my favorite for many reasons, and that's salmon. 3 ounces of salmon, so fatty fish is what we're looking for, will give you 800 international units. And salmon is also a source of omega-3 fatty acids, which are protective against heart disease and might help with cognitive function. 8 ounces of fortified milk will give you 100 international units. There is also fortified orange juice that has been fortified with calcium and vitamin D both. And 8 ounces of the fortified orange juice will give you 100 international units. How much is too much vitamin D? The IOM states that 4,000 international units should be the top level. So if you do take supplements of vitamin D, be sure and read the product information and find out how much you're getting. 4,000 is a fairly high ceiling, but because everybody's pushing it so much, we may see people that are taking too much. What is the recommendation for vitamin E supplements? This person heard that it was important for a healthy heart, but now they're hearing that it's not that healthy for you. Vitamin E is a fat-soluble antioxidant. Your fat-soluble vitamins are A, D, E, and K. And vitamins A and vitamins E are considered antioxidants. And antioxidants protect our cells against damage. As we get older, we produce what's called free radicals. And the free radicals contribute to a lot of complications. And taking in antioxidants protect us against those free radicals. And for that reason, vitamin E may be protective against heart disease, but this link has not been well established according to research studies. Foods that provide vitamin E so that you can get it naturally, which is where we would prefer you put the focus. Nuts and seeds are good sources of vitamin E, and I'll give you an example of some. Vegetable oils are good sources of vitamin E. Green leafy vegetables and again fortified cereals will many times have vitamin E. In the American diet, most of our vitamin E comes from the oils that we use, soybean, canola, corn, and the products that those oils are used in. The adequate intake for vitamin E for adults is 15 milligrams. So to give you a comparison of some foods where you can get vitamin E naturally, wheat germ oil, 1 tablespoon, will give you 20 milligrams. So in that 1 tablespoon, you're actually getting slightly more than the adequate intake. 1 ounce of sunflower seeds will give you 7.4 milligrams. 1 ounce of almonds gives you 6.8 milligrams. So nuts, which are also heart healthy and have also been linked to prevention of diabetes, they're promoted in the DASH diet, the dietary approaches to stop hypertension. So nuts are a good food group to be working into your balanced diet, and you're going to get good sources of vitamin E. This next question, I actually cannot give a good solid answer for. Someone had a history of breast cancer and wanted to know about the safety of taking supplements because they had read conflicting information. This was not an area I was too familiar with because in my small rural community, I don't deal with many clients in terms of cancer treatment and prevention. So I went to the American Cancer Society page, and the information I found dealt with taking supplements while you're receiving treatment for cancer. And their statement was that researchers and clinicians believe that taking higher doses of antioxidants, vitamins, may change how radiation and chemotherapy drugs work. But they can't agree, is it helping or is it harmful? Some people think that it helps the efficiency of the drug treatments. Others think that it is harming the treatments. And there was another statement that said most oncologists advise their patients to avoid antioxidant, vitamin, and mineral supplements during treatment, but the advice is typically ignored by the patients themselves. So I could not find anything that says if you are in remission with a history of cancer, are they helpful or not? I don't feel comfortable saying one way or another. What I do feel comfortable saying is check with your physician and follow their advice. There was a question about what does low fat or low calorie mean on a label. The FDA controls the definitions of what can be included on labels. Low fat means there are 3 grams of total fat or less per serving, and low calorie means there are 40 calories or less per serving. We had a couple of questions on taking individual supplements. One of the questions was, is biotin a good to take? Biotin deficiency is rare. And most people, very few people would actually need a biotin supplement because we are getting adequate amounts of biotin naturally in our foods. And our bodies also recycle the biotin that we've already consumed. So we're very efficient with biotin use. In terms of the claims that biotin supplements are effective in treating acne, eczema, which is a skin disorder, or hair loss, those claims have not been proven. So if you were considering taking extra biotin in relation to any of those, you probably don't need to. You probably have adequate stores through your diet and how your body recycles, and we have no evidence they would actually even help those conditions. The next supplement was asking about zinc supplements for immune support and helping with skin issues such as acne. Zinc is going to be in the news again before too long and on your commercials because it's a popular treatment for the common cold. However, the evidence for supporting that zinc is efficient at helping combat the common cold or curing you of it once you get it is controversial and contradictory. We do not have hard evidence that says zinc is helpful in that manner. There are studies that found that it was. There are just as many studies that disprove that and said taking zinc lozenges, for example, or zinc supplements made no difference at all in terms of colds. Zinc does help fight infection and heal wounds, but if you are eating a well-balanced diet, you probably have adequate amounts of zinc. And our studies have shown that if you already have adequate amount of zincs in your body, taking supplements provided no extra benefit. In terms of acne, there are studies because zinc does help with skin health. There were some studies showed that zinc could help with acne, but too much zinc can cause problems. So you should not take zinc for that purpose unless you have checked with your doctor about supplemental zinc or topical zinc for acne, because there are dangers and side effects associated with it. You should focus on increasing your zinc intake through your diet. How do I know if the multivitamin I am taking is the right one for me? There are a lot of choices out there on vitamin and mineral supplements. You want to choose one that is designed for your age and gender, because as we mentioned earlier, at the different stages of your life, your needs will change. Women vitamins, as we talked about earlier, if it's the mature woman, it's going to be designed with less iron in it, based on the fact that you're not going through menstrual cycles. Men vitamins for men also include less iron because they do not lose iron like women who are still before menopause. For seniors, I do recommend that you look at a vitamin supplement designed for individuals. I hate it when they say seniors are after 50 because I'm in my 50s. I'd like to think I'm not in that senior category yet, but in terms of vitamins, that's where they base the cutoff. And there are some nutrients that slow down as we get older. Some examples are calcium, vitamin D, as I mentioned earlier, and vitamin B12. One of the reasons we become less efficient at absorbing vitamin B12 is vitamin B12 requires an acidic environment in order to be digested and metabolized. As we get older, the acid level in our stomach decreases. We're not as acidic in terms of our gut. And so by producing less acid, we are not going to absorb vitamin B12 as well. So if you don't eat many meats, because we talked about vitamin B12 is only found in the animal products, although you can get it in fortified cereals, you can also look at a synthetic vitamin B12, and your body actually absorbs it easier because the synthetic vitamin B12 does not require an acidic environment in order to be metabolized. But again, I would ask you to talk to your doctor about your vitamin B12 level because they can do lab work to test for that. And then you can see if you need to consider using a supplement. But you can also focus on fortified products, and cereals are one of your best choices. The last question we had was my thoughts on the nutrition facts label. It is going to be revised, and they are currently collecting comments from individuals and organizations about the proposed changes. And so the question was, what do I think about some of the changes that are coming up? At the conference I was at a few weeks ago, I went to a session on this, and it was a very interesting discussion, and I like the majority of the changes that are coming up. They're going to require that companies put in information about added sugars. So an example the person who asked the question gave was Raisin Bran cereal. It shows a high sugar content on Raisin Bran cereal, but you don't know how much of that is the sugar from the raisins and how much is added sugars. So with a new food label being proposed, you're going to be able to tell. And we're hoping that consumers, because we consume a lot of added sugars, that if we can now see it on the label, we might make better choices and consume less. The new label, they're going to update the daily values for some of the nutrients like sodium, dietary fiber, and vitamin D. They're going to make the sodium recommendation, I believe it was at 2.3 grams, 2,300 milligrams. The fiber was an interesting discussion. Currently, the daily value is set at 25 grams. And there are rules that if your product provides 20% or more of that 25 grams of fiber, you can say your food is an excellent source of fiber. If you provide between 10 and 19%, you can say your food is a good source of fiber. So the proposal is to increase the daily value from 25 grams of fiber to 28 grams of fiber, which matches closer with what we ask the average consumer to eat. Someone from the peanut board, and they did declare, they were with that organization, was concerned because they said if you take it to 28 grams, we can no longer say peanuts are a good source of fiber. And I do like to promote nuts, and fiber being one of the reasons, in addition to the healthy fats they provide. So I found that discussion interesting, that it's going to in fact affect how companies can label their products if they change the levels of daily values. I do like that manufacturers are now going to be required to list vitamin D, which is a public health concern in terms of nutrients, and also potassium. Potassium is very beneficial in helping to regulate blood pressure. It also helps with your heart function. And increasing your intakes of fruits and vegetables, which we have encouraged you to do, is going to help you get adequate potassium intake. They are going to take off the calories from fat because they emphasize that the type of fat is more important than the amount of fat. And honestly, when I work with clients, they have no clue what they're supposed to do with the calories from fat on the label. Probably the most controversial change is that the serving size is going to change to what's routinely consumed by consumers. It's called Reference Amounts Customarily Consumed, the RACC. An example is ice cream was listed at 1/2 cup, and we would all agree very few people eat a 1/2 cup of ice cream. So the serving size is going to go to 1 cup. The concern is we're going to imply that should be your serving size. What they're doing is showing for those that do eat 1 cup, you need to understand how many calories and saturated fat and nutrients you're taking in. Our job as health professionals, and there are many enrolled in this MOOC in the health profession, is to educate the public. Yes, this is what's being presented for 1 cup, but let's talk about what serving size fits best into your diet and will help you maintain the best health. So really, it's back on us to talk about the serving sizes because it's going to be confusing. But in some sense, it will help. A 20-ounce bottle of soda is now going to be 1 serving, whereas in the past, it might have said a 20-ounce bottle of soda was 1.8 servings. And so the information was provided for 12 ounces, and people might drink the 20 ounces thinking they were only getting the calories that were listed for the 12 ounces. So in that respect, it's going to be helpful. They're going to put the calorie and serving size more prominent on the label, which I really like. And they're going to shift the daily value column to the left of the label, which I also like because we read left to right. So that's going to have us paying more attention to the percent daily value, and they're going to explain that a little better. One of the things that I like, and I'm going to hold this up for you, is the alternative format. And this is being considered. And notice how it says quick facts, foods to, I got to turn and look, avoid too much and get enough of. And so I like that, avoid too much, cholesterol, sodium, saturated fat, get enough. Is that showing upside down on your screen?
I have a delay.
Oh, he's got a delay, can't tell. When I'm looking at it on my screen, it's upside down. I don't know if that's what you're seeing or not. But if it's upside down, that'll just challenge you in learning the information, just in case it is. That didn't help either. Okay, so I like the alternative label. I don't know how successful it will be, but it's being considered. Okay, so that's some information on the micronutrients. Next week, your last lesson, week 6, is on stress, emotions, and decision-making process. So we chat during week 6, and we are going to talk about meal preparation and planning in the chat next week. But because it's officially the last week of the MOOC, although content stays open for an additional 4 weeks, I also want you to include any questions you have about the effect of emotions and stress on eating. So next week's chat is going to cover meal preparation, meal planning, and then also emotional and stressful eating. So you may have to get into the lesson a little earlier if you'd like to contribute questions so that I make sure I have them for next week's chat. So thank you for watching this video. I hope you found something that was of benefit to you, and I look forward to our chat next week.